Thank you very much, Professor Frosch, for the introduction. I'm going to present you a short overview about the patient shielding and how to implement the new recommendations from the IAEA perspective. So, as Professor Boris Brklacic said, that all our recommendations are based on scientific evidence. And this is one of the high-profile policymaker documents. And if the country is recipient of any type of our support, it's mandatory to follow these recommendations to implement in their national requirements. So in Radiation Protection and Safety in Medical Use of Ionizing Radiation Specific Safety Guide, it was said that shielding of radiosensitive organs, such as gonads, lungs, and eye, the breast, and so on, should be used when it's appropriate. Different type of documents in different levels, you can find that in the Safety Report Series number 71 for radiation protection of pediatric radiology, that additional shielding can be important for dose reduction. Gonad and breast shielding reduce the dose to the organs. Then even in CT, bismuth breast shield needs to be routinely used for examinations involving breast tissues. Radiation protection in dental radiology safety report series state that shielding of radiosensitive organs should be used when appropriate and according to the national regulations. At the lower type of documents, IAEA series number 24 dosimetry in diagnostic radiology for pediatric patients, the application of shielding in pediatric CT can be considered. Then, in general, for patient shielding, should be shielded in pediatric patient whenever the placement of the shield does not obscure important information in the clinical images. But, as was said previously, all our documents are based on the scientific evidence. And there are a lot of scientific evidence that the use of contact shielding provides just a false feeling of safety and protection. And the IAEA, we react to this new scientific evidence, not such news, but in the latest 10 years. And 2 years ago, it was held a consultancy meeting on the patient shielding in X-ray imaging. The purpose of meeting was to review the existing scientific evidence and available guidance from all professional bodies and to advise on the need for updating the existing IAEA guidance on patient shielding and recommendations. Very shortly about the meeting's highlights. Obviously, scientific evidence are that the routine use of the contact shielding provides minimal or absolutely no benefit for dose reduction in most clinical applications. Shield tools in the field of view or very close to the field of view may block important anatomical region and jeopardize the correct diagnosis. But to use thyroid protection is one of the doses that might be reasonably advised to continue when it not interfering with the field of view because the projection of the beam. So perception and ethics of using of shielding tools. As I said, shielding might provide a false sense of safety to the patient, but also to the staff, who might ignore other factors for dose reductions. And the contact shielding may be, and still it is, the only radiation protection measures visible to the patient. But in reality, there are many, many other dose reduction tools in the clinical practice. So this is strongly related to the education, training, and communication of the professionals and communication with the patients. But we have legal problem with the legal requirements. So for mandatory routine patient shielding exists in many countries. This aspect should be considered especially in countries with lack of good involvement of professional bodies in the decision-making process. So, what is the current implementation of the shielding practice? It's very heterogeneous between countries, but even the practice is inconsistent also with the country level and even in the hospital levels. So there is a lack of standard protocols and guidelines, and the high workload and lack of sufficient human resources may be a challenge for applying properly all dose reduction measures, tools, including contact shielding. So, what are the most important challenges in implementation of the new available recommendations? So, despite the evidences, we are aware about that. There is a strong need for attention and anticipation of the soft side of this complex issue. That means psychological perception, cultural attitude, etc. And then it's absolutely necessary closer involvement of radiographers and patients in the process. So we suggest gradual cessation of routine use and proper use when relevant. So there is a need of developing of guidance specific to every single modality, body region, etc. Then there is a need for patient or parent emotion to address and patient and parent emotion, and preference should be given and properly addressed by providing sufficient information and providing consistent messages. Regulators also need guidance, and communication strategies are extremely important and have to account for all aspects, from scientific perspective, emotional, ethical, cultural, etc., etc. So our unit and the International Atomic Energy Agency, Radiation Protection of Patient Units, is working on updating the list of frequently asked questions related to the using of contact shielding, work on designing new posters for health professionals as well as for patients, working on updating the training packages that include new recommendations on using contact shielding, and considering development of a new online training module on this topic. So even considering development of a new IAEA publication on use of patient shielding. Thank you very much for your kind attention.
Thank you, Professor GERSHAN. Due to time, we